Hi everyone, my name is Grace, and I am talking today about the nurse's role in addressing the community health needs amidst a vaping crisis in teenagers aged 12 to 18 years old. So, teenagers are becoming more and more accustomed to vaping thanks to societal acceptance and peer pressure. Over 28% of teenagers between the ages of 14 and 17 report having tried e-cigarettes, which was a noticeable rise from 9.6% in 2019. That was from the Australian Institute of Health and Welfare. The inhalation of the harmful nicotine and chemicals in e-cigarettes poses long-term risks, specifically for adolescents' development. The early exposure to nicotine and toxic chemicals raises specific concerns about long-term health. According to the Australian Institute of Health and Welfare, around 87% of the young people obtain nicotine-containing vapes without a prescription. Adolescents are highly influenced by their peers, leading to increased vaping rates within social circles. So, vaping among teens is tied to their social environments where peer influence plays a significant role. Many teens unknowingly inhale harmful substances, and ease of access remains a major issue. So, the role of the nurse in raising awareness of this issue is through health education. Just educating the adolescents and their caregivers about the dangers of vaping, which is including nicotine addiction, could be respiratory issues. So that could be done through school programs, community centres, and online platforms. Risk assessment. Nurses conduct regular risk assessments to identify young people vulnerable to vaping. They collaborate with all educators and parents to intervene early and measure long-term health consequences. And then there's community collaboration. So nurses work closely with multidisciplinary teams that involve public health officials and school counsellors to design prevention strategies for the community's needs. So in Australia, nurses are crucial in determining the risk factors, creating and utilising screening tools and doing routine evaluations to evaluate the dangers associated with youth vaping. Measuring nicotine dependence and encouraging better behaviour are two benefits of educating at-risk people about the risks associated with vaping. Continuous adaptation and efficiency are ensured by the routine evaluation of assessment procedures. So, nurses provide a pivotal role in providing proper education to caregivers regarding vaping issues in 12 to 18-year-olds by providing proper information, offering resources, and discussing preventative measures to safeguard them from vaping-related health issues and promote a healthier life for them for the future. The contribution of nurses is highly required for the prevention of vaping-related concerns. So, the nurse would offer personalised education. The nurses must assess a caregiver's current concerns and knowledge about vaping. They can also offer realistic strategies for intervention and prevention. They have to provide updated and accurate information on the health effects and risks of vaping, including respiratory problems and nicotine addiction. They can discuss the symptoms and signs of vaping issues in kids, such as wheezing, coughing, and shortness of breath. And they can just inspire caregivers to have honest and open communication with the youth regarding the harmful impact of vaping. So, collaboration with a multidisciplinary team is an excellent way to address vaping related issues among Australian children. The Australian government will be able to effectively address this issue by using a collaborative strategy. Collaboration between healthcare professionals and nurses will assist kids by providing comprehensive treatment and resources to protect them from the various negative effects of vaping. The nurses must collaborate with multidisciplinary teams such as educators, social workers, and healthcare providers to address the vaping issues in 12 to 18-year-olds. They share expertise and knowledge with team members to give comprehensive support and care. They can involve specialists, including counselors and therapists. They can work together to develop personalized plans for intervention, treatment, and support. They can engage in daily conversation to ensure consistent support. And nurses can promote a collaborative environment that promotes shared goal setting and decision making. So, the Australian government needs to implement workable policies to discourage youth vaping. One way they can accomplish this is by providing more funding to quit vaping. Other tactics include establishing and putting into practice robust plans, evidence based standards, and policies to improve treatment and prevention, and offering resources and support like education and counselling. They also involve encouraging interdisciplinary collaboration and communication, and just general knowledge is needed to accomplish this purpose. So, vaping among 12 to 18-year-olds in Australia is a complicated issue that needs a multifaceted approach. Recent approaches might be insufficient and require more innovative solutions to address these emerging issues. Um, Healthcare professionals and caregivers need additional help and collaboration. The resources that are available now is not enough. So, to wrap it up, increasing the rising trend of e cigarettes that are used by Australian youth signifies that urgent need for comprehensive public health strategies to address and measure the issues. The upcoming regulatory changes are expected to restrict access to e cigarettes, which could help to decrease usage rates among young people, but at the same time, by them not having access to it, is the crime rate going to increase? And are they doing illegal things to gain the vapes? That's a whole other issue. And the continued prevention efforts, along with effective enforcement of new regulations, are vital to tackling the increasing trend and protecting youth health. Addressing the main surge in youth vaping requires a multifaceted approach, effective policy implementation, and robust educational initiatives are key to setting increasing trends and ensuring health outcomes for young Australians. Thank you for listening.